Hey everybody, welcome to night 2 of our 7-day series for National Infertility Awareness Week. Tonight, let's get it going here. We are excited to have Patty Teagle with us. And she is a licensed counselor. She also runs the Resolve-based infertility group in Bismarck. So for those of you who live in Bismarck, we'll get more information on that. Our hopes is we can actually get more going throughout the state. And Patty can help work with anybody who's interested in starting one or knows of somebody who would be of benefit to starting one. Believe it or not, Bismarck's the only one. So especially Fargo, if anyone knows somebody or is willing to start one there, that would be great. Let's just see here. We'll just wait a few minutes here for Patty to come. We hope you are enjoying our series, and as always, feel free to ask any questions in the comment section. Let us know you're watching. And if you have any questions on anything from previous nights as well, you can message us or you can leave it in the comments section. You can private message, or you can private message the presenter as well too. We will save every video from each night to be watched later, and so you guys can go back. Remember, if you share the video also, it's a bonus entry to, there she is, to our contest we have going on. The contest is pinned at the top of the Beating the page. Hey, Patty.
Hey.
Welcome.
Thanks.
I'm at work, so I'm like, of course it happened. I got called into work when they're supposed to do this, but I impromptu'd our nice waiting room here at Ashley Medical Center. So
we're making it work.
We are making it work. You know, it's fine. It's all good. So this is Patty Teagle, and I will let Patty take it from here, do an introduction, and Patty experienced infertility and miscarriage too. So huge benefit to our community. She's wonderful at what she does. I've known her through her work life when I was going through infertility, and now for her to be one of the only infertility support groups in the state, really, at this point, is huge. Yeah. So take it away, Patty.
Well, I think, I've heard recently that we've got a support group not affiliated with Resolve, but that's going in Williston. So hopefully they're continuing to meet, I believe, once a month as well. So yeah, I went through my own infertility journey. My husband and I, we're kind of like how you said last night about you wait for that perfect time and, all the stars to align, yeah. And then it's just supposed to happen, right? Yep. You've decided for that magical time, and it wasn't happening. And so I got the diagnosis of PCOS, which is polycystic ovarian syndrome. I've never had a cyst in my life, though. So mine is more the insulin resistance PCOS part of it. So affecting hormones in that way that my body's just not doing what it's supposed to do. And so having cycles that were lasting longer and longer, the longer I was off of my birth control, and having to do some medications to try to get that to start itself and whatever. So then within the course of doing that, got pregnant. And I really believe there was probably not a good environment for that pregnancy, with just the way that my cycles had been and having to do the medication to bring that on. I can't imagine that was a good space for a baby to start to grow. So I miscarried that first pregnancy, but for me, there was also hope in that as well, because then I felt like, okay, it's been, a year and a half of us trying to start a family. And as much as, that was terrible, the, silver lining was that there was some hope in that, okay, at least I know my body can do this. Otherwise you're just wondering, hey, is this ever going to happen? So then it was about a year and a half before I was pregnant again, and we did like medicated cycles. I didn't have to do any of the injectables. We did IUI. Um, we did have some insurance coverage. I know we've been talking about that. You guys talked about that last night too. But we were, in our mid 20s and mid to late 20s as the, process went on. And we didn't have the finances to just kind of take it all as it came either. So we were having to figure out between, the health savings plans that we had or whatever insurance coverage we had, and kind of had to pick and choose, how much are we going to do right now? Do we need to, wait for a couple months or whatever? And so we had decided to take a break from, medical interventions for a while. And I decided to start the master's program for counseling and thought, okay, I'll just focus on that for now. And then, we can hit the ground running again once I get through this program or towards the end of it or whatever. Meanwhile, I had been taking metformin because of my PCOS. So that's a medication that's used for people who are diabetic or borderline diabetic to help with that insulin resistance part of it. And that had given me my cycles back on my own. So then I had regular cycles as I was taking that metformin. Now my body was doing what it needed to do. So I started my master's program in August of 2010, and February found out I was pregnant. So wasn't really planning on things to go that way, but that's how it goes, right?
Yes.
We wouldn't plan that, but
no,
here we go.
No planning.
So, and now, my son is 7.5 and in first grade. And after he was born October 2011. And I was still going through my master's program. And the whole time that I was going through the infertility process, even before I was in my master's program, I wanted to talk about it. Yeah, I guess probably not surprising that I'm a counselor and I wanted to talk about it, right? I'm like, who else is having to do this? Is this normal? Like, I wanted to know. And, and everybody has their own choice and control on that of where they feel comfortable. So I can't really fault anybody for not saying anything, but I was one that I wanted to talk about it. I didn't need to be quiet about it. I didn't necessarily feel ashamed about it in the sense of, not wanting to share it that way, but it was still like, okay, but what does this all mean? And how do you deal with this?
Right.
So I decided to start a support group so that anybody else that came along that wanted to talk about it would at least have that place that they would know, okay, here's going to be somebody once a month that, even if it's just me and one other person, sometimes I'm there, so that you can talk about those things. And so I started the support group in March of 2012. So we've been meeting for 7 years now.
Wonderful.
And we meet once a month. It's the third Monday of each month. We meet at Evangel Church in Bismarck. And they've been, great over the years to let me keep using that space. And I don't have a set curriculum. I don't have a set, anything for that. And I could have changed the focus of the group once I became a licensed counselor, but I wanted to keep it in that peer-led support group. So, we come, whoever wants to come, you can share as much or as little as you want. We give updates if there's updates, if you've been coming more than once, of just kind of what's been going on. And then we just kind of go where the conversation takes us. It might be around the holidays and people are getting Christmas cards, and, that part can be, difficult. Or maybe they've been getting baby announcements, or, hearing about pregnancies, or maybe, it's a time where family events have been coming up and they have that cousin that's pregnant who didn't want to be pregnant or whatever. And so that's where the conversation goes that month. It's kind of whatever it needs to be. And I've had husbands come a few times. Generally, though, it's the ladies, and they kind of like that, to have their space to talk freely too, because sometimes it's maybe about the husbands that don't
Right.
seem to get it, or
Right.
they're frustrated or whatever. And it's just because there's different communication going on, and generally it's, the husband feels just as much as his wife does, but sees how emotionally draining this is for her. And I don't want to add to that by telling her how upset I am that we're still not pregnant and all those things. But she's like, I just want to know that you're in this with me. I'm not doing this alone. I want to know that you give a rip that we haven't been able to get pregnant for 2 years or whatever.
Right.
So, sometimes that's a part of it too.
Right. Wonderful. And so along the husband line,
Yes.
what are some other common directions you've seen, possible tidbits of support or things like that for that direction?
I would say just the communication. I mean, that's always going to come back to it, no matter whether we're working as a couple just on day-to-day things or these big, heavy things. Just being able to talk with each other, and also being able to take some breaks, even if it's not for a month or two at a time, because obviously in infertility land, that feels like a lifetime to us if we have to wait a whole month again. But maybe it's a weekend that we're not talking about babies and pregnancy tests and, whatever else, or the size of my follicles. We can just have a weekend of, getting away and hanging out and being, a normal couple again.
Right. And that gets forgotten a lot too. It's just...
Right. Well, because nothing is normal anymore.
No.
It's hurry up. I'm ovulating. Get home.
Now, hurry up, come.
you're late.
Yes, you're hurried by an hour. It's going to be over with. So, in regards to the support group, and anyone can come to this, no matter if you live in Bismarck or if you live in South Dakota.
Right. If you want to drive, we'll take you. Because, I've had, people drive from, as far as Dickinson to come. Some, obviously are in the community, and others in the surrounding smaller communities too. We're not a big group right now. I'd love to have more people come. We know that you're out there, right? 1 in 8 of you come and talk,
Yes,
So, and I'm there no matter what, once a month. So sometimes, like I said, I sit there and talk with one person, and, we'll visit either for the full amount of time that we have the support group, to meet, or if they talk for a while and are, okay, I'm good. I got it off my chest, then okay, fine, we can be done too. But yeah, so, but I'd love to have, more coming, because like I said, I know that they're out there, and I know that, those frustrations are still there. This didn't just suddenly go away in the last few years. So even though our numbers are not very high right now, come.
Yes. So one thing I forgot to mention, you also testified for us during in legislation this year, and you focused on the impact of mental health that infertility brings, and I thought it was amazing. So I think sometimes people try to downplay it, like a baby is a choice, it's not a need, and I could go on in my rant too about so is a hip replacement and a knee replacement and your hernia surgery. So but to you, and in that moment, it's everything, and so it affects mental health. Huge.
Yeah, because our kind of fertility, story, all of those things, we have a narrative that we start creating when we're little. I loved my baby dolls. I played with my baby dolls all the time. I had them sitting in my rocking chair in my room. That's where they were. They went with me outside. We set up forts. We played in our basement. And to me, though, when I played, I would have the babies and I would go to work and I would come back. For me, that was how I played it. That there was like playing babies, and then I'd play office, and then I'd go home. But so we have this narrative of what this is going to look like that starts from a young age. It's not like I just woke up one day and said, hey,
Yeah.
I've heard that people have babies when
Yeah.
they get married. This is an interesting idea. So
Concept.
we have to think about how deep seated this is for all of us, and not just the women,
Right.
boys play house too, or when they're going fishing or hunting with dad, or when they might be playing a sport and they might think, I'm going to, teach my son to play catch someday, or I'm going to take him fishing, or I'm going to coach the little league team or whatever. We think about what life is going to be like when I'm a parent. And these are things that, like I said, started when we were young ourselves. And so all of that stuff, stays with us and evolves over time. And we have these ideas of what that's going to look like. And so to, ever be dismissive about that as if like this is not a big deal, it's a huge deal, because then this just racks our identity too, of, well, who am I if I can't be this mom that I've always wanted to be, and that I have this deep yearning to be this mom? What does that look like then? Or what's wrong with me? Or if there's something wrong with the man, as far as, sperm production goes, that's also a hit to our masculinity, in society at times, of, the jokes that people say, about having Olympic swimmers or shooting blanks or whatever these derogatory things are. And people can laugh it off, but it's not funny and it's not a joke, because if those, things are at play, I'm not having a family like I thought I was going to, or in the time that I thought it would.
Right, right. And it hurts my heart when I hear people downplay it. It's a recognized disease. It's a diagnostic disease, just like anything else is. And so I think we need to give ourselves that space to feel it and to go through it and to treat it properly. And that involves mental health, taking care of mental health. And that involves going to see a counselor sometimes too, such as yourself. So what kind of basic tips or advice or words of wisdom would you have to get people to come in and talk to a counselor, or, when to start that, or?
I mean, each person's going to be so individualized with that. I have people that I've seen that came in kind of on the tail end of things, or feeling like, okay, we're kind of at that point of, we need to decide, are we done? Are we, what is this resolution, which is why Resolve is called what it's called. But what is that resolution to our infertility going to be? So sometimes it's more at the tail end. Other times it's people recognizing, I am not handling this well. I am super bitter and resentful that my sister-in-law is pregnant, and that is my niece or nephew, and I shouldn't be feeling this way.
Right.
And so, there's those things too. But I think, to even start with self-care for yourself, and taking those weekend breaks, with your spouse, to be able to have time away from, thinking about all those stuffs or talking about all that stuff. Obviously, it's never far away, even when we're not trying or taking a break. Good Lord, we still know when we're supposed to be ovulating.
Yep.
But to be able to, I can tell you exactly, right? So, doing that self-care part of it, if that's even just a starting point before you're ready to come and talk to somebody, or, getting a journal, to see the journals that people have, where it's, these almost like medical documents on a notebook of, the follicle size, and, what day I took what medication and whatever. And okay, that's lovely. And obviously it serves a purpose for us when we're going through it, but that's not talking about how you felt that day. It's not talking about what emotions came up for you when you, found out you only had 2 follicles and one of them was really not that big, and, whatever. And, some people watching it are maybe, what's a follicle? Well, and that's okay too. But, being able to express those thoughts and feelings openly, and knowing like a notebook is going to be a safe place to start doing that. There's not going to be any judgment there.
Right.
You can do that. I also have, written a couple articles and gone and talked to groups as well to just try to educate, away from, the couple and the individual that's going through the struggle, but what can you do to help support somebody who's going through it as well?
Yes,
because
on that too.
Those thoughtless comments that people make with
relax.
Yes, with my PCOS, I could have relaxed on a beach all day long and I wasn't going to ovulate. And if you don't ovulate, you can't get pregnant, So, and I think we all agree, even when we vent about those things, that nobody's meaning ill will when they say these things, they're genuinely trying to think of something helpful to say, but it's not received in the way that you're intending it to be. And so being aware of those things too, that, getting yourself educated. If you know somebody who's struggling, do some Google searches, go to, Resolve's website, go on WebMD or something, or Mayo Clinic, something that's going to be legitimate information of just what does this look like? What is an IUI? What is IVF? What is a follicle? What are these medications that they talk about? So that you're maybe understanding what they're going through better, and that you're not just flippantly throwing things out like, oh, just relax, it'll happen, or why don't you just adopt? Or there's always IVF. Like, these are not cheap, easy options.
They don't fix the underlying problem at hand.
No.
And Resolve, I know, has a whole section dedicated for family and friends with like nice layout too. I saw when I was looking around too.
Yeah.
I'm just saying, how are you? And giving a hug. Say nothing and just give a hug. Pray for me. Something simple and kind like that.
And for us to be able to say something too, or be prepared to say something, that if somebody comes to us and says, I want to support you, I don't know how, give them some suggestions. What would be helpful to you, rather than just being upset about them not knowing, try to come up with something that they can do that would be helpful to you in some way.
And I think for me personally, that changed as I progressed through. So when I first started trying, so when I went to IUI to when I went to IVF, that need and support too, and what could be done kind of shifted as well.
Right.
And of course, those good medications just make those hormones,
Yes, people easier. Feel awesome.
Yeah. Like $1 million most days.
Tell me your helpful comments. Really, I dare you.
Yeah, tell me your comments during IVF.
Right.
And that's why I think it's so important that we start talking about it more too, to the public, but amongst each other, and to find our group and our niche, even if it is one person like Patty once a month, like she's neutral. I always say counseling is so wonderful because it's neutral. No matter what you're going through, it's a neutral person. You can't tell anybody anything, so that's even better. I mean, let it out. Like, just maybe it's work and home life and infertility. A counselor is just a wonderful place to be, no matter what you're going through in life in general. Yeah. My patients and friends will say I hand it out like candy. So I'm all about
that's good. Good girl.
Mental health day.
And being prepared to even educate your counselor, not to say that they shouldn't, take initiative when they find out that they have, a client coming in who's dealing with this. We should be proactive to get educated ourselves to what, understand what that looks like. But being prepared that you maybe can't spit out, IVF and, different sorts of, short-term, things that when you're in it, or 2-week wait or trying to conceive, whatever things that you might say, don't do the abbreviations, you may have to explain a little bit what that looks like if your counselor doesn't know, and that's not necessarily by a fault of
Right.
their own that they don't, because this is a specialty area that you have to seek out. You know, we don't have classes offered in a master's program
Good to know.
of infertility counseling. You know, that's something that I had to seek out, of finding a textbook that was recommended to me and, you know, combing through that on my own, or, you know, finding trainings that might sort of, you know, address that. But there's just not tons and tons of training for that either.
Right.
As far as to like just sitting out there. I mean, you need to look for it a little bit as a professional to find that stuff.
Right. That's good to know. I don't know if I knew that myself. That makes sense though. You know, everyone needs continuing education. I suppose it's the
Yeah.
same way with that. If anyone has questions too, you can, like I said earlier, you can put them in the comment section or contact Patty on the side, or you can message us and I'll make sure to get them to Patty as well.
Yeah.
Do you have any one last, you know, suggestion, tip, or advice you'd give somebody who's maybe just starting the journey, looking back on yours and your profession, that you would give them?
Well, I think, you know, Kristen actually, you know, mentioned it last night too, and I talk about it in the group when people are starting, because we can't compare our stories to each other, really. You know, each person's struggle is their own. So, you know, Kristen and I walked through infertility at the same time, and our paths look very different, you know, of how that was, but we still got together and had coffee before I was doing the counseling and before I was doing the support group, and talked about some of those things. And, you know, those emotions are still the same. You know, it may be more prolonged for one than the other, or there may be, you know, different levels that it gets to with IVF and, you know, failed IVF cycles and things like that. But I don't have a frame of reference for that.
Yeah.
You know, like going through my struggle, I didn't have that. So my struggle was my own, and whatever I went through with that felt raw and real and hard, and was a challenge, you know, and stuff that I had to deal with, and that my husband and I had to deal with and talk about and figure out how we were going to navigate that. So not to think, oh, well, I've only been doing this, you know, for, I mean, we haven't gotten pregnant for 8 months, and now we've just been charting, and, you know, it doesn't matter. Like you don't need to earn your way in by having so much pain and suffering into this before you can get help, or before you can find support. You know, that doesn't matter. It's our story is our own. Our struggle is our own.
And I want to add to that too. I think the same goes for miscarriage. I think whether you saw the 2 pink lines at home and you miscarried 2 days later, or you were, you know, I mean, I'm not going to compare as far as like stillbirth, but you know, a miscarriage is a miscarriage. And so feel that. I mean, the second you see that you were pregnant, you get emotions.
Your mom.
Your mom.
I mean, that's where your feelings go. Yeah. That's where that is, you know.
I don't like the word chemical pregnancy. To me, a pregnancy, you're pregnant. You're pregnant.
Yeah.
Like, there's no such thing as a false positive. So, I think to compare, oh, you were only, you know, such and such weeks, you know, is harsh too, and I see that happening amongst different people and situations at times too.
Well, and part of infertility is not being able to carry a pregnancy to term. Some people can get pregnant, but they can't stay pregnant. So, you know, for the support group, you know, people love it when the ladies come back and share that they've, you know, got a successful pregnancy, you know, or that they've gotten that, you know, successful cycle and they're pregnant. But I tell them, you know, if miscarriage is your thing, or if you're still, you know, unsure, you can keep coming back until you're showing, you know, because you still are going to need support. But then when you're showing, it's a little bit probably in your face, you know, as far as the support group goes to, you know, keep coming.
Part of our bill that we brought forward, if you have more than 2 miscarriages, you're in, because that's, you know, like you said, it's not carrying a pregnancy to term. So our bill, and we're going to bring it back again, if you've had more than 2 miscarriages and can't sustain pregnancy, it would benefit you and provide that extra needed medical care coverage you might not be getting. So that's part of it too. And such
Definitely.
a topic. I mean, who wants to say I miscarried, and come talk, someone's talking about their blood pressure being elevated openly. You don't talk about miscarriage and reproductive system of any nature.
Right.
So it's
Right.
breaking that stigma. Let's talk about it amongst one another. Find someone who's been even through miscarriage and just know you're not alone in that either. And it's
Right.
raw emotions and to go through that.
Yep. And there are some different groups that are around in the state too for support after miscarriage and infant loss.
Yeah, the Bismarck one, right? Oh, I should
Yep.
have got the name. Sarah Murray. If you're on or watching this, she helps run it. I met her too through this wonderful infertility journey. I'm calling it wonderful because it's I've changed how I look at the whole thing and where it's come and where I've been. So I'm changing my hurt into hope, I always say. So Sarah, we'll post that link. I'll try to find it. We'll put it on the comments of this section too for that support group for miscarriage and infant loss too.
Yep. And when we at Evangel, there was a Bible study for a while too, towards that topic of miscarriage and infant loss. So, if somebody was interested in that book, I could get that information to them as well, because it'd be something where you wouldn't necessarily have to go through it with a group. You could do it on your own, or if you had a couple friends that wanted to do it. It wouldn't matter if it was a recent loss or if it had been, a while ago. But if faith is an important part of your life and your healing and things like that, why not go through something like that yourself?
Wonderful. Well, did I miss anything, or is there anything else you'd like to?
Oh my gosh, we could be on here forever. Let's be honest about it.
My patient might be me, but I mean, they know where to, I can't hide here. Work too hard.
We can regroup and do it again another time,
Like monthly thing. I don't know.
Right.
We'll throw some suggestions. We can have monthly topics or something.
Right. How often do you want to hear from us?
Yeah, because we could sit and just
right.
Go. Well, once again, if anyone has questions, feel free to ask now or later. If you watch it later, share the video, even if it's a private message to somebody could benefit from it. And don't forget to enter our contest we have going on too. And tomorrow we will be meeting with Desiree, I think. Breast cancer preservation, and they're part of it.
Yeah, that's good.
Yeah. So, well, thanks again, Patty. And
absolutely.
Patty's going to be on KX News Thursday, we hope. Friday?
Thursday, they're interviewing me, so I'm not sure if they'll put it on Thursday or Friday or where that will go.
We don't care as long as they do it.
Right.
Thanks again, Patty, for everything.
Yep, absolutely. Thanks for everything you're doing, Tara, too, because, and for the advocacy part, because I know that was part of what was on here, too. I can only do so much, across the whole state or whatever, so it's like I started this support group and, would kind of do the things that I could do here or there, but I can't do everything by myself. And, and you're stepping up to do the legislative area that, was not something that, I felt was my wheelhouse or even necessarily even called to do for that to be a part of it. When you reached out and you're like, is this a thing? Like, would people want this? Yes, they would. You do this. So if there's other people, that are watching or around that are like, okay, I have this gift or I have this knowledge or I have this connection or I have this passion to do whatever, we're not like, we're good here. We're doing what we can, but anybody else that would, have a passion to, get the word out in some way, start by posting stuff on your Facebook like this week. And then, how else can you be reaching out to people, or how else do you want to get involved at the state level or the regional level, or or even across on a bigger scale, because they in May every year Resolve takes representatives from each state, is what they hope to do. I haven't been able to go. It would be great for that to be a goal for us, to get there and meet with the big legislators there, and addressing what the needs are for our state and the country that way. So, I mean, it's a huge range of ways to get involved, and, we're working on our do-it-yourself walk for hope. And so that, will be another way for people to get involved and, do things. So, in whatever way people want to get involved or feel like they can, or whatever ways they can offer, do that. Don't think like, oh, Patty and Tara have it. We're good here.
We need help. And especially with our walk coming up. So even if looking ahead, if that's something you'd be interested in, just helping hand out t-shirt. I don't know.
We don't know what we're doing yet exactly,
Yeah.
but yes. Or if you want to make t-shirts.
Yeah. If that's your thing, like, join us. And
Right.
I just talked to a girl from South Dakota Sunday. I'm going to speak in South Dakota in 2 weeks from now.
Oh, yeah.
Baby Expo, but that's okay. They want infertility, so heck yes. And they're going to get a bill started in South Dakota, and I'm going to help her with it, because if South Dakota gets it, more to us,
Right.
in 2 years. So, and it's just helping and offering, even if it's, hey, I don't do this, but I can just help you. Here's what I would recommend. Even a recommendation. I mean, we'll take it.
Yeah, definitely.
So, wonderful. Well, thanks again.
Yes,
and please look for our awareness walk. We'll be doing it in August or September. We're hashing it out. It'll be at the Capitol. We know that.
Maybe we'll even be able to announce that by the end of the week.
Yes.
Our date.
Yes. Good goal for you and I.
Right?
Okay, have a good night, everybody.
You too.
At 7:00.
See ya.
Okay, bye.